to fit in tonight. And last time we ran this, it actually went a little late, so I'm hoping that we can be super efficient this time. We're going to go around the room and have some introductions because there's a lot of people in the room that probably don't know each other. So welcome everybody and thank you so much for coming. Tonight we are going to get all of our groups together and just so that you know, about at least a third of the room are people that are helping to organize this evening. So thank you very much to all of our amazing assistants. In the operating room, we've been running simulations for probably close to 10 years now, give or take. And there's some really important people for me to thank from the OR side. A couple of these people couldn't be here today, but I'd like to thank Dawn and Paul behind Dawn and Sarah. She's hiding. Is hiding. She's shy. And Sebastian, and a couple other nurses that couldn't be here tonight. On the Emerge end of things, Drew has a similar kind of parallel team. Yeah. To help make tonight happen, there's a bunch of people that I'm just sending a thank you to. Jack in the back here
in the corner here
has come from Victoria to help film this event. And we'll kind of go over the lay of the land in a bit, but thank you very much, Jack, for coming and helping make this happen. I would also like to welcome Danielle. Dr. Meunier is here also from Victoria, and it just so happened that she was in the area, so she is attending in person this time, which is super awesome. Danielle, do you want to introduce yourself and tell us what you do?
Hi everyone, I'm Danielle. I've been in Victoria for just over a year now. I do all of the heme path. It's very busy, but in terms of the transfusion side of things, I get involved when there's an MHP to help guide sort of the product choices and make suggestions and help with the coagulopathy. That's kind of my role, is primarily assisting because crazy things are happening at the bedside, so I kind of sit back and keep an eye on the labs and help guide the coagulopathy management. And then in the background, a lot of inventory management too, that you guys don't necessarily hear about, but we're shifting products around. Platelets in particular can be particularly scarce.
Because we have two here.
Yeah, there's like two in an IMO for, so
Two
sometimes.
units of platelets?
Sorry?
2 units of platelets?
Yeah, at any given time, yeah.
Wow.
Yeah.
Those are pooled units though, eh?
Yeah, I mean, it's a dose, two
Yeah.
doses, right? Two doses. So, yeah, that's my role in these situations.
Not that there will be an MHP or anything. So you might want to take down Dr. Meunier's number. During the course of events, if you do want assistance from a hematopathologist, you will want to maybe pick up the phone and give her a call and help guide things as the evening progresses. So maybe
Thanks.
take a picture, have her number, so that you have it on hand.
I feel like that's a good hint.
Missed it.
It's gone.
Just gonna show Danielle.
So what I'd like to do is go around the room and we'll just introduce ourselves and tell us a little bit about who you are and where you came from.
So I'm Drew, I'm one of the Emerge docs, do a lot of sim as well. Be part of the facilitator team. So I'm not working as Emerge doc tonight, I'll be part of the organization.
My name is Alex, I'm an Emerge doc.
I'm Rob, I'm Buffalo too. I'm one of the emergent trauma physicians and I'll be helping these guys tonight.
So you're going to be helping Jack with
Yes, I'm going to be helping Jack. I'm going to have a camera on my head. And I've been warned specifically to not go to the washroom.
If you do, I will cut the feed from your camera.
Thank you.
Nobody else.
maybe we didn't specify, but kind of, is that this will be filmed and live streamed, so because there's so many people, we can't all go en masse together to all of the places that we might end up tonight. So when you're not involved, you'll be in here and can see it thanks to Jack and Rob on the screen. But you're also consenting to us filming you because otherwise you can't really be part of this. And then this will be saved
Sneaky sign
and
and sheet.
put onto, is it YouTube, Jack?
Yeah,
On
it's YouTube.
On YouTube, so if you miss it, then you can go back and rewatch.
This is getting a little intense, really. You didn't mention that.
Can I sign out now?
Just on that note, actually, while we're talking about that, in terms of the actual flow of things, just to elaborate on what Drew said, we're going to be starting in Emerge. Actually, let me just get to that slide. So we're going to be starting down in Emerge. If you think there's a possibility that you, in your role, might be called down to Emerge to help manage a trauma patient, for example, maybe our general surgeon might be called down, some of the people from radiology might end up in Emerge with this massive trauma patient. If you think there's a possibility that you might be involved, please head to Emerge. Otherwise, if like those of us who are in the operating room, we'll stay up here and watch the streaming. And then things will switch, we will transition to the operating room. Oops. So ideally, if the trauma bay is clear, we'll be moving down to the trauma bay. Then the
It's clear.
patient will move. Clear.
For now.
So then the Emerge group will come back to this room, watch the streaming of the operating room, and all of those people engaged in the operating room will move to the operating room. We're actually going to physically move the patient from the trauma bay to the operating room. At that point, once the OR is finished, once the surgery is finished, we're going to move that patient down to radiology. We'll be in the CT scanner area and we'll wrap up in the radiology area with some more exciting things happening down there. The most important part of the evening, though, is coming back here at the end of the night and doing our roundtable discussion and debrief. That's where we'll really get to the meat of some of the things that we've learned, like about MHP and about simulation. So just to go back to some of the slides I skipped. These are the formal learning objectives for the accredited course tonight, but specifically tonight, what we're going to look at is the hospital process for MHP. We are going to practice clear communication between all of our groups, and in particular, clear handover, because we know that that's where a lot of the errors, medical errors, can happen. So really be mindful when you're handing over to someone, say for example, RT, I don't know, I saw Allison here somewhere. So when RT is handing over to anesthesia, for example, it's really important to make sure that your handovers are clear and concise. Another thing that is kind of cool to think about, because we're all different departments working together, is how can we best support each other in the middle of the night when you know that there's a shortage of personnel, and we're all short. In the operating room in the middle of the night, we have so few people, and I'm sure that's the same for Emerge, and radiology probably feels pretty empty in the middle of the night too. So another objective is it would be nice for all of us to meet some new people. I know there's some new faces for me. We have no disclosures, and that's kind of the lay of the land for the evening. Did I miss any housekeeping items?
I don't think so.
A few things actually. There is a little bit of a delay between the streaming, between real time and the streaming. So sometimes that lag can be perceived. And that will perhaps be a little bit important to keep in mind if and when you're calling Dr. Mounier. I'm sure I'll think of other little things as they So what I'm going to talk about in the next 20 minutes, I'm really going to skim through everything really quickly, so I apologize. Oh, gosh. Yeah,
I
I'm
think it's
so
stopping
sorry.
me. I mentioned a camera and then we went over to
My name's Chelsea. I'm one of the emerge nurses.
I'm Ben. I'm one of the emerge nurses.
I'm Jen. I'm a unit clerk in the Emerge.
I'm Natalina, unit clerk in Emerge.
Raylene, EDC&E. I'm Kayla, I'm a nurse in the OR.
Alex, I work in X-ray and mammography.
I'm Esther, I work in the OR. Courtney, OR.
Eddie Emerge.
Sarah, OR nurse.
Lonnie, OR.
Jen, anesthesiology locum.
Welcome, Jen.
I'm Will, radiology.
I'm Chris, I'm the clinical nurse specialist for trauma services.
I'm Melissa, I'm one of the emerge docs, and I'll just be behind the scenes.
I'm Sebastian, I'm one of the anesthesiologists, but today I will be a general. We missed the back row.
Yeah,
Jack, the tech here.
Patty emerge.
You guys already met me.
My name's Donna, operating room.
Scott, anesthesia.
Allison, respiratory therapist.
I'm Carly, I'm one of the MSIs, I'm here on anesthesia.
Brent, I'm an ER nurse.
Who's me? I'm Sarah, I'm one of the AAs helping out.
I'm with her.
So tonight, in the next 15 minutes or so, I'm going to skim through a little bit about simulation. We're going to touch on crisis resource management. And for those of you who have done a lot of SIM in the OR and in Emerge, you're probably familiar with that. Is there anyone who hasn't done a lot of SIM or who has maybe is not familiar with crisis resource management? Great, excellent. That's awesome. So we will be using a cheat sheet with some crisis resource management tips and techniques. And so we'll come back to that in a bit. And then I just have a few little comments about running an MHP. And then we're going to head off into our different places.
What was your patient volume?
So simulation, there's many different definitions of it, but this is my latest favorite from John Veal, who is an anesthesiologist who runs SIM in Vancouver. His definition is the simulation of real-world situations so that healthcare providers and others involved in the delivery of healthcare can learn, practice, research, predict, and assess, free from clinical risks and demands. So the thing about SIM is we try our best to make it seem real, but clearly there's going to be things that just don't feel real, that aren't what would normally happen in real life. But it is really important to kind of overlook that and to try and get into the moment and think about what you would do ordinarily in real life in this kind of situation. Simulation has some pretty distinct phases that have been established by some of the big sim centers like Harvard. Canada actually has a really big name in the world in simulation, and it's somewhat standardized. So the preparation has gone on. We started the preparation for this back in April and did run it in June. So it's a lot of work to set something like this up. This is called the pre-brief, so setting the stage for what is going to come. Then moving into the simulation. And tonight, because we have so many people and so many different phases, we're not going to run it quite like we normally do, which would be simulation and immediate debrief. We're actually going to run the emerge part, and then the OR part, and then the radiology part, and then come back here for a big debrief discussion. The debriefing itself also has some specific format. We're probably going to do away with the formal debrief patterns, though, just in view of how many people we're trying to accommodate. And those of you that I know have a lot to say. So we'll dispense with some of the reactions phase, and we will go over an event review. And the idea of that is that often, and in real life, there's so much happening simultaneously that you may be caught up in the moment in doing something when something else of equal importance is going on in the room at the same time, and you may completely miss what has gone on. So the event review in the debrief is really important. We'll do some summarizing and pull out any questions that anyone had in our final debrief. So interprofessional education, this is like the best interprofessional event, really, truly. There's not a whole lot of places that run interprofessional events like this, maybe because of, I don't know, the lack of resources, time, like it's really hard to organize stuff like this. So we in Nanaimo, we really rock it, we really do, because it's not, it's something that other places aspire to.
There's a resident who just showed up. When he comes in the room, we're all gonna laugh, like cheer, and make us feel really off.
Is it your husband? Tell him.
It is.
When he comes in.
Is he gonna turn red?
He's getting supper first.
Just lots of cheering.
Or we just had true cheerleading.
So a team of experts is not an expert team, and that's why we're practicing today. Interprofessional competencies are kind of like
Welcome.
I think this counts as hazing.
So we've already done introductions. Would you like to introduce yourself?
Hi, I'm Peter. I'm one of the residents. Drew says I'm on probation. I'm not sure why.
Are you coming to the OR at some point in
I
your
would
career?
like to join you guys any which way possible.
It's a great
Great
message.
answer. So I said we'd get back to crisis resource management.
Really happy with your prank.
I'm delighted.
CRM involves a whole pile of things that we do intuitively, but sometimes it helps to actually make it a little bit more concrete. So the communication piece, we all know, is really, really important. It's important to be aware of, say, fixation errors, where you just go down that rabbit hole of seeing one thing and forgetting about what else is going on around you. Anticipating and planning, so for the leadership, it's really important to say out loud what you're thinking and sharing your mental model. So these are some of the things that we think about with crisis resource management. And to that end, we do have a CRM skills checklist that we will be using tonight for each of the scenarios. We'll assign one person who's not actually actively involved in that part of the scenario to stand back and take note of some of the skills that they see demonstrated. So, for example, if you see people identifying themselves and identifying their roles, you may note that down. Closed loop communication, which is one of the basic skills that we do all the time, every day. We'll have the blank side of this CRM checklist for you to fill in, and we'll come back to you during our final debrief and talk about some of the CRM skills that we observe. And here we are practicing. This was a pediatric sim that we ran last winter. Cognitive aids, I'll just mention, there's lots and lots of different resources that you can use. I highly encourage you to make use of anything that you have at your fingertips. The trick with cognitive aids or memory aids are that you have to be familiar with them and how to access them very quickly. So VHA Island Health has a lot of really good information online. If you can access that information, that's awesome. Sometimes people have apps on their phone that are really useful, like pediatric doses, for example. If you can access those apps on your phone quickly and you know how to get to them, by all means, I encourage everyone to use them, to make use of them. Because we know that in crisis situations, we tend to forget all the things that we know, but we tend to forget them. And cognitive aids really help pull everything together. So you can use whatever tools you like, whatever is helpful to you. And then just a couple words about trauma. Just a reminder of the trauma triad of death. So it's a cyclical thing. Once you get into a large amount of blood loss, you can move into a coagulopathy, and that coagulopathy increases the amount of acidosis. And the acidosis in itself causes poor myocardial function, which in itself can lead to decreased perfusion, and therefore, we've all seen patients shut down and get really cold, and that cold temperature enhances the coagulation disorder, and it's a circular thing. So wherever we can, we try and minimize or abort that trauma triad of death. A couple other things that I'll just put out there. There are some, for the unit clerks who are joining us today, and for people who are putting in orders for an MHP, there are a couple order sets. The first one is the blood transport request. And that's the first one that needs to be pulled up when an MHP is called. The second one is actually a really valuable order set, because if you actually look at it, there's a lot of things that you might have forgotten. So for example, it gives you the opportunity to order all of your products, but it also reminds you to give TXA, and it has a whole list of the blood work that you might want to have. This is a continuation of that same order set. It reminds you to give calcium. And just while we're talking about calcium, are you familiar with the differences between calcium gluconate and chloride?
Yeah, so it's 3 to 1.
3 to 1.
Calcium chloride to calcium gluconate.
Yes.
Both can be given peripherally, but it's going to hurt. But if you're going to use calcium gluconate, you use 3 grams compared to 1 gram.
Yeah, and the thing with calcium gluconate is that you actually need a functioning liver to cleave it in order for it to be effective in the body. So really what you want in a trauma situation is calcium chloride. And ideally it's given through a central line, but if you have a proximal IV, it's probably going to be more effective than calcium gluconate. And then the third order set is once the MHP has been initiated, there's a second order set that has the opportunity to give you ongoing blood products. So Danielle, did I miss anything with order sets or anything there?
That seems about right.
Okay. Awesome. So rules of sim. This is a safe place, and so I encourage everyone to just jump in there and make mistakes or whatever. This is a great time to learn and make mistakes. It's a respectful environment, non-judgmental. We do hope that everyone will have a chance to participate tonight. There's been no tricks built into the scenario, so it's really meant to portray a true life trauma situation. And we try and keep it confidential because like this one is the second time we've run through it. We may use the same scenario again. But we do encourage you to take what you've learned tonight and share it with all your friends. So a couple housekeeping items. In real life, trauma situations like this feel chaotic, and tonight it will feel like chaos, and that's okay, because that's real life. If you have any questions about what you're seeing, what the patient response to some intervention that you've had, feel free to ask us. We'll give you the answer. It's not a secret. Just a little reminder that the setup in between each stage and the connectivity with the mannequin may take a while. And apologies if the electronics don't work. It's always we just pray it's going to work. But you know, maybe not. So we'll wing it. And the other thing is that because we're filming it and because a lot of people are trying to hear what is going on, if you're not the one actually speaking, try and not speak. Be very quiet. No side conversations going on. So it can be really clear to the leaders who are running the situation, to the other participants, and to the viewers what's happening. So that's it. Does anyone have any questions? We're going to try and make it back here by around 8:15 for our debrief. Okay.
Sounds great.
Okay. So if you are in Emerge, or you think you might be called to Emerge for a major trauma, then I'll have you head down there, and the rest of us will stay here. And just before you head down,
No.
is Drew up there?
I got the zip.
Zipped up.
So you're telling me
No, we was down here.
order it?
Last time we did just like a coffee.
Red blood cell order.
Yeah, but it's easy.
Alex,
It's super
Give a
easy.
verbal order to your nurses.
Yeah, so they are the ones that are perfect. That's what I do. I just assume.
Yes, you need to order.
But Alex, the order set's the easiest order set you're gonna use, so.
Yeah, yeah.
Honestly, it's the, no, you were using it. It's the easiest you're gonna use.
But it just seems like I don't understand.
Stop calling them, they're too busy running around like fans.